Hi, I'm Dr. Kelly Harper, founder of Tuscan Ridge Animal Hospital, and today we're going to talk about urinary problems in cats. The most common urinary problems that we see in cats would be urinary tract infections, feline interstitial cystitis, or what we would commonly refer to as just cystitis, and urinary stones that are either in the kidneys or in the bladder. I'd also include in that urinary obstruction. We see that problem far more commonly in male cats, but they develop problems where their urinary tract is not open and the cat is unable to urinate either at all or a sufficient amount to be considered normal. So those would probably be my top 4 urinary problems that are seen in cats. So commonly cats will show increased interest in going to the litter box, and they may be getting in and out of the litter box repeatedly or often in a very short period of time. Sometimes they are producing urine when they're in the litter box, but it may be a very, very small amount. And other times they're trying to urinate, but they're not able to pass any urine at all. That, of course, would be in the case of a urinary obstruction. Other signs of urinary problems in cats would be what we call inappropriate elimination. So cats are now having accidents or are choosing to urinate outside of the normal litter box. That oftentimes can be associated with blood in the urine, but not always. Sometimes the urine looks perfectly normal and the cat is urinating outside of the box. And then I think also to a lesser extent vocalizing. When your cat is in the litter box, if you ever hear your cat crying during the course of trying to eliminate, that's a definite sign that there's a problem. So I would say the number one way to tell if your cat's having a urinary emergency is if the cat is unable to produce any urine at all. The cat is in the box, straining to urinate, making frequent attempts to do so. Oftentimes when they're blocked, they will be vocalizing because they're in pain. They're trying to eliminate and they actually can't. So I think for an owner, it's really important you pay attention to your cat's litter box habits. And if you're noticing that they're making frequent attempts to go to the litter box over and over again in a very short period of time, and or when they're in the litter box, they're crying and not producing much urine or any urine at all, that to me would be considered an emergency, and I would be reaching out to get help for your cat at that point in time. So the first thing we would do is we'd want to actually do a thorough physical exam. Oftentimes, if the cat is blocked, we will be able to feel that. The bladder on palpation will be very large and hard, as opposed to a very small bladder, and which would indicate that the cat probably has some urge incontinence to be going in and out of the litter box, but they're not necessarily obstructed and unable to urinate at all. So physical exam is really, really important. Always paired with a really good accurate history from the owner as far as what's been happening at home and what they're seeing with respect to the litter box habits of the cat. And then the best way to be able to determine if there is an actual problem with the urine itself is to run a urinalysis. So we're able to get urine from a cat in a couple of different methods. Sometimes the cat is so irritated that they will, even during the course of the examination, they may urinate on the table. Other times we just actually get the urine, we collect it directly from the bladder via ultrasound guidance. I think that there's a lot of treatments that are available to treat urinary problems in cats, but the short answer is it's really dependent upon what the problem is. So, for instance, not all cats that urinate outside of the litter box are doing so for a medical problem. Sometimes we have to determine whether or not, or always we need to determine whether or not the inappropriate urination is the result of a medical problem or a behavioral problem. If it's a medical problem, then we're going to treat it based upon those needs. If there's an infection, antibiotics would be prescribed or administered. If it's a cystitis case where there's not actual infection, there's just inflammation in the lining of the bladder, in those cases, we provide supportive care to help reduce the inflammation in the lining of the bladder and the urinary tract so that the cat is more comfortable and is less likely to feel this urge to go to urinate repeatedly and over and over again. We may recommend dietary changes to help reduce inflammation in the bladder and, more importantly, to reduce the chances of crystal formation. Crystals are the precursor to stone formation, and they can be commonly seen with cystitis. So in those cases, additional fluid therapies would be recommended, a dietary change, and of course for all cats, it cannot be overemphasized the importance of encouraging your cat to drink water or have access to fresh water at all times. Cats very commonly are drawn to water sources that are moving. So fountains or leaving a trickle on at the kitchen sink or your bathroom sink are great ways to encourage your cat to drink more, and drinking more helps flush out that urinary system. So those would probably be some common recommendations on how we would manage urinary problems in cats. And of course, I will kind of loop back around to that distinction between if it's a medical problem or behavioral. If we do determine that your cat's urinary problems or inappropriate urination is a result of a behavioral problem, there are also medications that we can give you to help your cat with that problem as well, and some environmental enrichment guidelines that we can talk to owners about. Yeah, stress is a really key component to a number of urinary problems in cats. So cats become very easily stressed out with changes in household. Simple changes like moving the litter box abruptly from its current location to a new location, or changing work schedules for the family, changing access to the owner if that changes and the cat is not able to spend as much time with the owner as they normally do. While those may be seemingly subtle changes in a family's household structure, from a human standpoint, for a cat, those can be highly stressful events. The introduction of a new baby to the household, that's a classic one, where you'll have a cat who has been urinating appropriately for months and months and months on end, and then mom and dad bring home a new baby, and suddenly the whole world turns upside down for the cat, and they manifest that stress associated with the new family member or the change in schedule by urinating outside of the litter box. In most of those cases, it's not a medical problem, it is a behavioral problem. So we again would give the owners some guidance on how we can best manage that situation. And that may mean adding additional litter box in the household. It may mean making sure that those litter boxes are put in quiet locations where the cat is able to just step away from the busyness of the household and the noise of a baby and so forth. So those are some suggestions.
Thanks for watching this video. I hope you found it helpful. If you have any questions about how we can better help your pet, please give us a call at Tuscan Ridge Animal Hospital.